Causes of acquired long QT syndrome. It can be by medication, diuretics due to the electrolyte imbalance, antiemetics like ondansetron, antipsychotic, haloperidol, pitapine or risperidone, TCA, tricyclic antidepressants, SSRI, citalopram, antiarrhythmic, amiodarone, sotalol, and plecamide, anti-anginal, that is ranolazine, anti-infective, including macrolide, fluoroquinolones, antifungals, metabolitic disorders like electrolyte imbalance, decrease in potassium, magnesium, and calcium, starvation, hypothyroidism, bradyarrhythmias, sinus node dysfunction, AV block, and others include hypothermia, myocardial ischemia, infarction, intracranial diseases, and HIV infection.